They've been called a game changer in treating COVID-19, but local healthcare workers say Wisconsin's supply of coronavirus pills are going unprescribed, and there are several reasons why. Christina Laurie explains who can and should be asking for this life-saving treatment.
It's not as easy to get these pills out to people as you might think.
When Wisconsin hospitals and pharmacies got their first shipments of COVID pills this January, healthcare workers like Dr. Bart Capone knew they'd be a total game changer.
They're for people who are at the highest risk of becoming very sick from COVID, but haven't gotten very sick just yet.
But he didn't expect getting the pills to people who need them would be so complicated.
They have to be given within the first 5 days of symptom onset. So if there's any delay in identifying the symptoms or any delay in testing or getting your test results, that's running the clock.
The two types of pills approved for use in people who are COVID positive and not yet in the hospital prevent the virus from reproducing. But one interferes with a lot of other medications, while the second potentially causes birth defects. However, for people experiencing COVID symptoms, they can be life-saving. Clinical trials have shown Pfizer's Paxlovid prevents hospitalization in nearly 90% of high-risk patients.
Equity becomes a key area to look at.
Mo Carbot says the biggest local problem is a lot of people don't know these medications exist. Only 20% of the doses SSM Health has received have been dispensed.
So we're not really seeing that level of scarcity that would require a level of, say, prioritizing patients as to who should get it and whatnot.
So how do you know if you're a candidate for these pills?
If you're someone who's at risk for getting very sick from COVID, it doesn't hurt to ask.
If you have an underlying health condition like asthma, call your doctor while waiting for your COVID test results to come in. And in the meantime, before you ever get sick, get vaccinated.
An ounce of prevention is worth a pound of cure. Get boosted if you haven't gotten boosted.
In Madison, Christina Laurie, News 3 Now.
DHS has a map on its website of locations that have either or both of the antiviral pills. You can find a link to that on our website.